Hello, welcome, welcome. We have our amazing team of public health students. This is the Assuaged student panel, and today we are speaking on the topic, the misuse of the drug, the prescription drug, Adderall. So I will go ahead and hand it over to, I think, Catherine, who is leading the beginning of the presentation. Yay!
Hello, you can all hear me okay?
Yes.
All right, so we're gonna start off just by discussing what is Adderall. So Adderall is a prescription medication, and well, Adderall is the trade name for a combination of salts and amphetamine that make up the drug. It is equal parts amphetamine and dextroamphetamine, which produces this levoamphetamine variant. A lot of big words, but pretty much that's what composes Adderall. Um, it is a nervous system stimulant, so it increases energy, increases, I guess you could say, when your nervous system fires, it's becoming more active. It's pretty much what it's doing to your nervous system. It is commonly used to treat ADHD. That's what it is prescribed for, but it is also misused by many people, specifically students, to study and complete coursework. It can also be used to, I guess, party and stuff as well, but it is usually used as a study enhancer. So, according to a study done by the University of Kentucky, 30% of students reported abusing an ADHD stimulant like Adderall or including Adderall at some point as a study enhancer. So, it is quite common for this to occur among students. So Adderall use for ADHD. So this is the use like that it is what it's supposed to be used for is ADHD. So ADHD is attention deficit hyperactivity disorder, and it often begins in childhood, but it is chronic. So it will occur throughout life, but it can get better as someone ages. But it is a long life-lasting problem. It causes attention and focus problems, hyperactivity, so, like just moving around a lot, and impulsiveness. The general treatment for ADHD is behavioral therapy and medication. So behavioral therapy to help them, what can the person do for themselves to make it so that they're able to organize and um, stay in one place and not move so much and think through their choices, as well as for families how to help their kid with those things, and a medication like ADHD. So stimulants are the meds used to treat ADHD, and Adderall is one of the most common used. It reduces the symptoms of ADHD, so it causes a person to be more focused and less impulsive. It pretty much is able to calm their brain down. So if you look on the slide at the picture there, right here, the brain on the left, that is a brain of someone who has ADHD, who has been diagnosed with ADHD. And on the right is someone who has a quote unquote normal brain, but someone who does not have ADHD. So you see all the red parts, the red and orange, that's activity going on in the brain. That's all the neurons and stuff firing constantly. And it's all over the brain. While here you see if someone's just resting, in an MRI tube, the activity is just, here and there, like slight thoughts and regular processes. But when you have ADHD, there's all these different thoughts and activity going around, just bouncing around in the head, and that causes it makes it a lot harder for people to focus and, stay still and make clear decisions. So the desirable effects of Adderall, what it tends to be used for, like why it's used for ADHD, but why it is also misused by people, is it increases energy. Since it is a stimulant, it makes it perks you up, you know? It improves alertness. So not just like wakes you up, but like you're really just like aware of your surroundings. And then it improves your concentration. So you're able to just stay focused on one thing. If you have to write a paper, you can do it. Like you're able to just stay on track with that. So that is why it is prescribed for ADHD, because people with ADHD have the trouble with, you know, staying concentrated and, you know, sticking with one thing. But that's, again, why people misuse Adderall. They want, you know, if you're studying for a big test or, you know, just coursework in general, the drug allows them to just quickly like focus on the paper and just write it all out. Or if, you know, they're going to study all night, they want to be able to study and concentrate the whole time as well as stay awake. So it keeps them awake and alert. And so that's why it is desirable for misuse.
Yeah, coming to Adderall, we have to understand what is the drug in a nutshell. So we call it by so many street names like Addies, Speed, Dexies, Study Buddies, because people who use it during studies, Zing, Uppers, Smart Pills, so many other names, street names. We need to know because like when our relatives or friends like they're going to take this and they're going to say like like I'm taking speed, then we have to understand like what they are undergoing. I mean, without a prescription or something they're going to take, so we need to understand all these street names. So Catherine has been discussing like the desirable effects, also like like what happens to the brain when you take Adderall. So now we are going to discuss why is it so addictive. I mean, like we take acetaminophen, we take so many other drugs, and we find they are not addictive, and why Adderall is becoming addictive. So we need to understand the mechanism with which the drug is acting. So the drug, when you take the Adderall, it increases your brain dopamine. Dopamine, we know, like like when some people are getting into some adventure, this dopamine becomes more. So we can understand your brain activity becomes more. So it increases the brain chemical called dopamine. So when there is an increased dopamine, we have like increased focus and all that, but it is short-lived. So what happens is like when you increase the dopamine, and we are so used to that effect, we have seen people who are adventurous becoming more adventurous. They go into the bungee jumping, they go into deep sea diving and all that because they want that back. If it's through natural means, through sports or something, it's good for you. But when you are taking a chemical and you are actually like like becoming addictive to that, like that's really really harmful for you. So then it increases the brain dopamine. It's going to cause euphoria. So like euphoria, we know like it's going to an ecstatic state or something, which is not a normal thing. We know the life is like a seesaw. When you just become like a more euphoric, the next moment you will fall into very deep depression. You will not know what you are undergoing. Your caretakers may not know what you are undergoing. So that's a problem Adderall can do to you. And a cognitive enhancing, which is good. I mean, like we can understand things better and all that, but everything is going to be short-lived. And the physical performance is increasing. It increases the alertness and endurance. And once like like you take an assignment and you just do it, and with Adderall I'm going to get like a 90 score. And without Adderall, like if I'm going to get a 70, then like it's my natural instinct to go for the Adderall and get the 90. So it's generally advisable for like the attention deficit people. They don't have the focus, they don't have the organizing skills. And so like when it's going beyond manageable, then like under a therapist or a mental health person, if they are prescribed for a shorter duration, it's well and good. But if we are going to go and take that drug and we don't know what's happening within us, like we are going to become more addictive. Yeah.
All right, so this is the effects of consistent Adderall misuse. So when we talk about misuse, we talk about we're talking about the use of Adderall without a prescription, or if you do have a prescription, if you are purposely taking an inappropriate dose. Or you could, of course, have without a prescription and taking an inappropriate dose, but any dose without a prescription is inappropriate. So according to the National Institute of Drug Abuse's annual monitoring report of college drug use from 2016, Adderall is the most frequently misused drug among college students. The increase of stimulants on college campuses has been on the rise. So there was already an increase of stimulant use, but it's getting even worse. Like it's more and more and more. And that's from two studies in 2014 and 2008. There are both short-term and long-term effects from Adderall misuse. Again, I just want to clarify that this is about if you misuse Adderall. You can still have, negative side effects if you take it when you're prescribed it for ADHD, but, your dose has been determined by a doctor to make sure that they are, you're getting the positive effects and like lowering your chance of any negative effects. And so that way, the good outweighs any potential harm. But when you do misuse, there's no one telling you, where the dose is, and you tend to go way above that. And then also, if you don't have ADHD, it isn't necessary for you to take it. So the short-term effects are sleep difficulties because of the energy increase, weight loss. It can be quite quick. And then disorientation, someone who's very, well, they're just very stimulated. Their focus is on stuff, but they're also, very hyper, I guess, because the effects of someone on ADHD, if someone with ADHD takes Adderall, it has an opposite effect than it does with someone who doesn't have ADHD. They tend to, actually feel more mellow and be able to focus, while people who don't have it, who don't have ADHD, they will be able to focus, but they will also be more high strung. They will be more, like if you drink too much coffee, that kind of thing, where you're just kind of jittery and everything like that. Memory loss is also quite common. Short-term memory issues. And then mania, so that high euphoric state where all of a sudden they're just super euphoric and they're all over the place and they're trying to get everything done and they have these, ideas of grandeur. And then long term, so if you've consistently misused Adderall, you can have semi-permanent sleep difficulties, like insomnia, things like that, fatigue from that, and also from just your body being on this on edge, this like chemically induced state of stimulation. And then mood swings. So, if someone's coming off of Adderall or they're addicted and they haven't taken it yet, it can cause these mood swings. And it's also, you're messing with your brain chemistry a lot. So you're trying to get back to homeostasis at some point, even everything out. But to do that, your body kind of goes into these little waves, and yeah, it can cause a lot of mood swings. Aggression, that can also be caused from, adding with the fatigue and things like that. But again, the stimulated state can cause people to get very aggressive. Tremors, so like if you drink too much coffee, the shaking, but like always shaking. Not, it might get better once you stop using Adderall for a long period of time, but when you've used it for so long and so much, it can be a problem for a while. Anxiety and paranoia can also come from that hyper alert state, and then just kind of like looking at everything and taking in too much or too stimulated, and the paranoia can also come from that. Hallucinations can also occur from long-term use. This is possible for pretty much any misuse of drugs. It's called drug-induced psychosis. And so pretty much any drug abuse for a long period of time can cause this. And then heart disease. It can put a lot of strain on your heart. Your blood pressure will go up if you're like misusing Adderall consistently. Your blood pressure will just constantly be up. You're constantly straining your arteries and your heart. And at some point, it just strains it too much and you have heart disease. So those are the effects.
Yeah, we have seen before a brain image of like how Adderall induced brain looks and how a normal one looks. So we can see, like clearly in this picture also that, like you are seeing all those red areas are those stimulated areas. So you can see like when a brain is going to overwork this way, like it is going to become tired after that. So fatigue is a very important reason. So, with all the short-term and long-term effects discussed by Catherine, we also need to know whether people can die out of Adderall. Yes, they can die out of Adderall abuse. They are going to take more. They can die. Like they can slip into a coma. They can just like get into like circulatory failure, collapse, convulsions also. So we really don't know which is moderate, which is very severe intoxication for them. So anytime we see a person, like we know a person has taken so much of Adderall, we have to take them to the hospital. Like we should never guess whether like, like they are okay. They are, like they can be okay after half an hour or so. We can never guess that. Immediately, we should get them because they can just slip into a coma after a while. So let's be very careful with that. And when we see the Adderall fast facts, like we need to know some facts about that. It's around some 8 to 15-year-olds. 8.6% of them, they have ADHD, the attention deficit disorder, for whom it's okay. The Adderall has been prescribed. But what happens when, like who are misdiagnosed, like who are given more? It's amazing to see that around 300 to 500 million US dollars is like wasted every year on misdiagnosis because any child who is hyperactive, we have seen hyperactive children. Does it mean they have to take drugs? No. We have to go to a mental therapist, like then, like see whether they really have, the ADHD issues. Even as a first step, they are not going to give Adderall, but give you practical steps how you handle them, like in a day-to-day life. The teachers will be trained. These days, teachers are trained also, so like it's not the first-hand measure to give Adderall, but like due to the misdiagnosis, we are spending more than $500 million on that. Think about the health of those children. And we have seen the symptoms and all that and abuses and everything. And severe reactions can lead to even heart attacks in small children. So let's be very careful in using Adderall. Yeah. So we have to see how Adderall looks like because we have seen our normal drugs, but like these drugs are commonly available in a small case or something. So we need to like like know how these drugs look. A 5 milligram looks like this, a 7.5 milligram looks like this. Like we have the dosage between 5 and 30 milligram, and so a 30 milligram looks like this, kind of a little oval or a circle. So once we see all these shapes, we know like what our loved ones are taking. Like some loose drug is there, we need to know that's Adderall. So this is one thing we can actually trace. Then like if we see like like where really the problem happens is like we need to know like what other things are happening with us or with our loved ones. So the main co-occurring disease is ADHD. Of course, for the attention deficit, we give Adderall. So that's why they get addicted and all that. So that leads to fatigue. We know anxiety and depression also happens out of that. The thing is, we have more common social, biological, and psychological factors. Once a trauma happens, say an example we take, a trauma happens, a childhood trauma happens, it can lead to anxiety, it can lead to post-traumatic stress disorder, it can lead to depression, it can lead to Adderall overdose also. I mean, all these can be due to a single particular incident, a trauma that happened in the childhood or any other reason for that matter. So when we have common factors that's contributing to many mental illnesses, we can see that like we can have a lot of mental diseases happening together. We always say like when a person is anxious, they are equally depressed also. So similarly, when we have an addiction for Adderall, we see that there are a lot of other coexisting diseases like anxiety and depression also. So one question is like, okay, we give Adderall to ADHD, and like we shouldn't think that the person will like like completely heal. That's not going to happen, because there is an associated anxiety, there is an associated depression there. So like like we should know, like we have to treat all those things, and that's why we are insisting here that you need to get help of the mental health practitioners. You have to go to a therapist and really get prescribed, like then you take a drug, because they will know how to treat you. It is not that you just take Adderall and you're going to have like a magic wand, you're going to heal completely. It's not going to happen that way. Especially when the brain is hyperstimulated, the person is at a very great risk, because they are going to fall into depression the next moment. Okay, so we need to be very careful when we are treating a person with ADHD. We have to find whether they have the associated other disorders, then treat them also simultaneously. Because Adderall, initially when they take Adderall, they will look okay, but they are not okay. So we have to understand that. So if you are not going to do that, then it's going to give more illness, more incarcerations, homelessness, suicides, and even early death is possible. So we need to be very careful.
So now we're going to be moving on to talk about smoking and some of the effects of smoking. And so as you can see right here, smoking does cause many different diseases and just negative health outcomes in general. Smoking can cause cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, which is COPD for short. And it also leads to emphysema and chronic bronchitis, which are more like in the lungs. And then there's also an increased risk for eye diseases, tuberculosis, a weakened immune system, and that can be especially detrimental because if you have a weakened immune system, you're going to be so much more susceptible to other diseases. And I think that's important, especially since we are in a pandemic right now. And then another risk or an effect of smoking is rheumatoid arthritis. So now I'm going to talk about some of the risk factors that are occurring when someone does smoke. And these are some estimates from the CDC, and it shows that your risk for coronary heart disease is going to increase by 2 to 4 times simply from smoking. Your risk for stroke is 2 to 4 times, and lung cancer actually increases by 25 times. So that obviously shows that smoking does play a huge role on your lungs' health. It also makes it harder for women to become pregnant, and once they are pregnant, it could lead to preterm delivery of their babies, stillbirth, as well as low birth weights in babies, and that can be very dangerous for babies and their health. Smoking affects your oral health because you're breathing in all these chemicals when you're smoking cigarettes, and so that's going to affect your mouth, obviously. And then you also have a risk of developing diabetes, and that is increased by 30 to 40% simply from smoking. And then, like we discussed in the past slide, there's a decreased immune function that's occurring, which puts you at risk for other conditions. So now here are some of the long-term effects of smoking, and we broke it down into the long-term effects as well as some of the positive things that could occur from quitting smoking. And so your risk for heart attack actually decreases exponentially only after a year of quitting smoking. And then 2 to 5 years after quitting, your risk of, I'm not sure what that is. The risk of short decreases by half. And then within 5 years, the risk of mouth, throat, esophagus, and bladder cancer drops. And then 10 years after quitting, the risk of lung cancer drops by 50%. So as you can see, even after quitting for like 1 year or more than 1 year, there's a ton of benefits of quitting, and you can actually reverse some of these negative effects of smoking in the first place. So here are some of the long-term effects of smoking. So as you can see, there's destruction of air sacs in your lungs, and that leads to emphysema, which is a disease in your lungs, and it affects your lung function. And then there's also permanent inflammation that affects the lining of your breathing tubes, and that creates chronic bronchitis. And so you're basically going to have a lot of breathing problems and coughing and whatnot. And then you're also at a risk for lung cancer. You have an increased risk of skin cancer and cardiovascular disease. And cardiovascular disease is basically heart disease. And so smoking does affect, like your blood flow and that kind of stuff. And then there's also a risk of mouth, throat, larynx, and esophagus cancer, which are basically all the pathways that the smoke is going to take when you are smoking cigarettes.
So with both Adderall abuse and smoking, one of the biggest things that we need to be looking at is anxiety and how that comes into play. Adderall is a stimulant, meaning that it's going to make you more awake, more alert, more energized, etc., etc. So when you overdo it, it sends your brain into like a complete hyperdrive, causing stress and anxiety that becomes unlivable with. Someone who never struggled with anxiety may all of a sudden have issues because of their Adderall misuse. They may think that they're helping themselves by taking Adderall for an issue they're having, but in all actuality, they're causing their anxiety to be a lot worse because of it. Another issue is smoking. So how this comes into play is many people claim that smoking is a popular go-to for anxiety relief. But regardless of if this is true or not, it comes at an extreme price. As we all know, smoking is detrimental to human health, as Luna just went over. So the cons of this method far outweigh any pros, especially when there are so many other ways that we can combat anxiety. Many people who do smoke and do end up trying to quit really struggle because one of the biggest withdrawal symptoms that comes up is the stress and anxiety, and it makes people a lot less likely to quit when they want to. So some of the general symptoms of anxiety and distress that may come up is just racing thoughts, rapid heart rate. Basically, everything is just going at 1,000,000 miles per hour. In extreme cases, there is immobility and paralysis, just the freezing that comes up when you are just so anxious. There's also sweating and nausea. So, this may seem like very temporary issues, but when they're occurring over and over again, there's a lot of long-term effects. All of the stress and anxiety can cause increased risks of high blood pressure and heart disease. Over time, there's also digestion issues, and there's also a lot of issues that end up happening with sleep and sleep disruption. So anxiety can take a long toll on your daily life. Just social situations become a lot harder, and you are very easily overwhelmed by small tasks. Excessive stress and worrying occurs, and there are a lot of important relationships you may have that may suffer. Some natural interventions if you're struggling for anxiety, first of all, in the case of Adderall abuse, is just making sure you have proper dosing on your prescriptions and medications. If you are taking, this goes for any drug, but in this specific case, Adderall, if you are not taking the correct dose, you are likely going to start suffering from anxiety. So that is the one thing you can do for that. If your anxiety is not Adderall related, then there are a lot of natural interventions that you can resort to that are not smoking. The biggest thing is going to go see a psychologist or a mental health specialist who is going to be able to work with you on any issues you're having. Another thing you could do is increasing your physical activity and exercise, moving around, just letting some steam off. And yoga is another really great mindfulness and relaxation process. There's so many different ways that we can be combating anxiety and preventing it, and we need to be looking at that before it becomes a big issue.
So one way to prevent Adderall abuse is to follow prescriptions precisely if you are prescribed Adderall. If you are not given a prescription, then it is highly advised to not take someone else's Adderall. Taking more Adderall than your doctor told you to can hinder the tolerance breaks and make your body develop tolerance. Tolerance builds with regular drug use, so the purpose of the tolerance breaks is to undergo a period of time where you do not take Adderall and your tolerance goes back down. Another way to prevent Adderall abuse is to notice signs of physical dependence and addiction. Dependency consists of taking higher doses since the originally prescribed amount ends up not giving the same effect as before due to the buildup of tolerance. Other signs are restlessness, sleep problems, excessive and rapid talking, and trembling or shaking of the hands and feet. On the other hand, addiction can be noted when someone cannot even get out of bed or do simple tasks without taking Adderall. Stomach problems, including nausea, diarrhea, or constipation, may take place, along with changes in appetite. When addressing ways to prevent smoking, the two most common goals are to, 1, decrease exposure of cigarette usage in terms of accessibility, in other words, decreasing the amount of places that sell tobacco, and cigarette smoke in the air, which leads to secondhand smoke inhalation, which is arguably just as dangerous as the smoke that smokers inhale. The second goal is to increase cessation, or in other words, encouraging people to stop. Some states in the US, as well as other countries, have already begun to increase taxes on tobacco products where consumers have to purchase tobacco at higher prices. Moreover, only having tobacco stores sell tobacco products rather than allowing grocery stores and pharmacies to sell them too is an example of enforcing stricter laws regarding where people can purchase tobacco products. Enforcing regulations on where people can smoke is another effective method. This type of regulation is often found in hospital settings where you cannot smoke within a few meters of the building, as well as in public buildings such as libraries and even in university campuses or dormitories. Mandatory health warnings on packages also serve to make tobacco products appear more unattractive, whether it is through words or images. Nonetheless, images serve as an effective fear tactic in public health campaigns. Restrictions on advertising or allowing smoking or tobacco products to appear on radio, media, or product ads may also serve as a way to prevent smoking because it does not add to the normalization of smoking. In the end, the best way to prevent smoking is to reduce or delay initiation of smoking among the youth. Merely educating people is not enough and is proven to be ineffective. This type of prevention can be done by mitigating modifiable risk factors, such as not smoking around younger relatives or children and teens, and increasing protective factors. There are 3 main strategies that could be implemented when spreading health education. Organizational strategies focus on helping others to identify and organize their problems. This may be done through community development, also known as locality development, social action, or organizational development. Training strategies are meant to provide participatory learning experiences to people so that they can develop skills and change their attitudes to improve their habits toward their health. This can be done through simulation in games, such as role-playing or looking over case studies, group discussions, or inquiry learning, such as problem-solving or using a discovery approach. Communication strategies are used to provide health information to educate and motivate the public. This may be done via lecture discussions, mass media, such as through print or electronic media, educational television or radio, or individual instruction, such as self-instructional courses. The outcome of these strategies are beneficial and they demonstrate how impactful health education is. As more people become aware of the services that are offered and where they can access them, more people are then likely to collaborate with their local health systems. One of the main goals of health education is to bring awareness to communities that there are sources of aid available and that clarity, that understanding, is what sparks the initial change in behaviors and attitudes. After they try the new behavior, such as brushing their teeth, if it was previously not a common practice for that individual group, and they see how healthy their teeth are by cleaning them often, and they see that they become more healthy in the sense that their teeth are not falling out at faster rates, then they will be more likely to adopt this new behavior because it benefits them, their body, and their well-being. Still, change only occurs if a person wants to accept and adopt that change. That is why it is important to showcase and, most importantly, explain facts to communities that are unaware of certain health conditions so that they are able to digest the information in a way that makes sense to them. After that, it is up to the individual if they wish to change, but usually when they do, they tend to stick with the new behavior. Yet, interventions are more likely to be only highly effective when they are designed for the specific needs of the community. For instance, if there is a group of people that are suffering from a disease, and yet they do not have a name for that disease, then it becomes more difficult to explain to that group what is going on, and it might be even more difficult to explain to them that they should change a few habits in order to prevent further contamination or infection. Instead, the health educator should create an intervention that is culturally sensitive to that group's way of being and find ways to express change in certain behaviors, which might help alleviate the disease that some of their community members might be suffering from, or how to prevent them from getting that same disease. So the American Addiction Center serves people who want to become sober. They offer services such as rehab, detox, recovery, and therapy. The phone number on the screen is available 24/7. SAMHSA, or SAMSHA, is the acronym for Substance Abuse and Mental Health Services Administration. It is an agency within the U.S. Department of Health and Human Services, and the mission of this organization is to reduce the impact of substance abuse and mental illness on America's communities. This agency does this by connecting people to treatment centers. Now, the National Suicide Prevention Line is a national network of local crisis centers that provide free and confidential emotional support to people in suicidal crises or emotional distress, which is also 24/7.
Okay.
Can you hear me?
Yes, we can hear you.
Okay. So our first question is, how do we reduce the access to prescription medications for those who do not have a prescription? So, people who misuse Adderall are able to get those medications even though they do not have a prescription. So how do we reduce that possibility? If anyone would like to chime in with any ideas, discussion about that.
I can go first. I actually did research on just prescription drugs in general not too long ago, and Adderall fits under the umbrella of prescription drugs, but so I saw that the past 20 years, the numbers of prescriptions have tripled, and that has led to like the increased amount of overdose. So I think part of the problem is just the increased amount of prescriptions. The more of it out there, the easier it is it's gonna be able to get. And oftentimes, like people are getting them from like family members, just like in the medicine cabinet. Simple as that. I think educating the community about the dangers, the risk factors of Adderall, for example, is really important. Just because it is a drug that some people need. So being that it is prescribed to people, some people don't really, they think it's safe, it'll help you. But as stated throughout the presentation, that there's many risk factors that come along with it, especially with dosage, continuous use, misuse, and yeah.
Like we used to have prescriptions from doctors, of course. So like people just take 2-3, if it's prescribed for a week, they will just take 1 or 2 days and they will just like save it for the future. I had a granny who used to store all the drugs, like she will not know the name of any of the drugs. She doesn't know why they were prescribed and all that. And she used to ask, like people, do you want blue medicine? You want yellow medicine? You want red medicine? So people used to choose the color and take those medications. Once like I became like I came to my senses, I just went to my granny's like cupboard and just threw all the medication. She was very upset with me, but still, like, that's how people are doing. Like it is prescribed for some other purpose and people are just taking it like for fun sake, or like like they think it's helping them, but it's actually not helping them. It's more deleterious to their health. Yeah, people have to understand that.
Awesome. Does anyone else want to chime in on that?
So adding on to what Indu and Kendrick were saying, so I know Kendrick was saying like the rate of people being prescribed these drugs has increased. And I think as much as these drugs are important for a lot of people and like they're necessary for a lot of people, I think sometimes doctors will just, prescribe drugs really fast and that's like their first solution. So I think, taking a more holistic approach and focusing on like, mental health and like therapy and that kind of stuff first. And, if that doesn't work, then maybe moving on to like more drugs and medication. And then also just, education is important because I think a lot of people don't realize like if they're misproperly using these drugs, there could be negative side effects.
And we have a comment from our friend Ivan in the Facebook who says like, he was actually like, he knew that he's inappropriately been given when he was in undergrad school. Yeah, this happens, Ivan. We really know that. That's why like we took this topic. Thank you so much for your comments.
Yes. So Adderall, in terms of prescription medications, I mean, used to take Adderall a lot myself personally, and it's very addictive, and it does add to smoking. I wanted to smoke more, I wanted to drink more, so it is a medication to just keep in mind. uh, we understand that people may suffer from ADHD and other disorders warranting this kind of prescription medication. So using in moderation and really when you're in need is advised for sure. I mean, all medical practitioners will tell you that. And so it is a controlled substance that, is starting to be cracked down more and more on how much it's prescribed and having to go see your doctor more frequently just to get your hands on it. But there are, natural remedies that we could resort to. We have organic coffee. Obviously, you'd want to drink that in the morning. That could help with the alertness. Um, Caffeine drinks are something that a lot of people will resort to, but again, it's just finding the best holistic ways to, you know, get that focus and that you're seeking in your studies or what have you. So I would say that's kind of my stance on that. Does anyone else want to add? Yeah. Is there any more? There's another question on here, I'm assuming.
We have more friends in our Facebook and all that. We really thank everyone for your presence and cheering us. Like we are just going through all your comments, and we really value your presence and your comments. Be with us. Like how we are having more discussions on our way. Thank you so much to everyone who is present for this discussion. Thank you.
Mhm. So you for this next discussion question, we're moving on to smoking. So it has been shown that vaping is pretty much it increases the likelihood of someone who might not have smoked before and then start vaping. It increases the likelihood that they will start smoking, especially with the amount of nicotine that is in a lot of the vaping products that you can also find in cigarettes. People start chasing that high. So how do we prevent adolescents from vaping if it is a trend among their friends? And just the peer pressure of it all.
Vaping is a very big trend, and actually, I just got an email yesterday stating that UPS, FedEx, and I believe DHL are now banning vaping products. Especially with it causing liquid in the lungs. So, you know, the variances between vaping and smoking in itself, there's dangers in both. Um, but again, tying to that, you would want to just advocate and educate. What's out there on the news. There are children dying and people, suffering from incidences related to vaping. So I personally, if big delivery carriers are going to start banning the shipping of those kind of products, that's something we ought to keep in mind.
Yeah, really, Cynthia. Like I had worked as, like a counselor with halfway addiction homes, and I know the impact of e-cigarettes because they were starting at the time. So during I think 2015 or so, and we have the neighboring countries. Singapore is very safe. So, but the neighboring countries they were like actually like sponsoring all this, and even like the chewing gums are banned in Singapore. You cannot enter there with a chewing gum. You may need to spit in the dustbin and then go in. So it's very strict over there. And Singapore, what they did is like from 18 years, they actually increased the smoking age to 21. So that actually that year they found around some 22% reduction in cigarette smoking, and also this kind of vaping and all that. I think all these government regulations and all that, and as you said, Cynthia, FedEx and UPS, yes, we all have to join hands. All corporates have to take action for this, and without that, we cannot protect our adolescents from all these menace that's running in our society. Yeah.
Excellent. Does anyone else have anything to add to that? Thank you, Jill.
I can go. So I think we're in a step in the right direction, I believe, and that's because primarily focusing on adolescents, they tend to, like the flavored tobacco product, vaping products. Like for example, Juul, that was probably one of the bigger nicotine products. They banned a lot of their flavored ones. So now they're strictly, I believe, tobacco and menthol. So yeah, I think banning the flavored nicotine products would help a lot. And that's, like I said, I think people around our age, like, or even younger, even not primarily going to go for the tobacco flavored vaping products. So I think just increasing surveillance and policies to restrict access to those flavored nicotine products will go a long way in reducing the use of it. And of course, with everything, educating long-term effects, short-term of smoking. Thank you.
Awesome. What do you think, Janan?
I kind of go off of what you guys are all saying. Just, you were mentioning about how like all the big mail carriers are starting to ban, the shipping of these products. And I think that just reducing access and making the accessibility of these products harder is one of the biggest things we can do to reduce peer pressure among adolescents. Because if nobody their age can even get a hand on these products, it makes it a lot easier to not have people feel peer pressured to join into that, if that makes sense. So just making sure it's harder to get, so that thus less people will have.
Amazing. Thank you so much for the input. Nicole, did you have something to add?
Yes, I have a younger brother who's 15, and this is something that I often concern myself about. And so what I usually do when it comes to these kinds of issues where he might try something new, but it's not really good for his health, I usually try to talk about those situations with him, but in a way that makes sense to him, in the sense that like I try to compare it to other people his age, so that way he knows that it's not just something older people experience. Because when you're younger, it's very easy to think that, oh, that's not going to happen to me. Like I'm invincible. I'm going to be just fine. Or I'm too young to get addicted, or like all those things. So when you put it in the context of these harmful effects are also happening to people your age, it does shift the perspective a little bit. And I've seen that his attitudes and I guess like his reactions towards these things have improved, in the sense that he's not as willing to try those things. But for other teenagers and even young teens who don't have someone to talk to them about these harmful effects, and about how you should evade these products, or maybe do something else, and maybe try this like when you're older if you really, really want to, even though it's best not to. Yeah, so I think communication as well as education is the most important thing. But I agree with what the other students have been saying about the lack of accessibility. I think that plays a huge role. If it's not around, you're going to be most likely like not inclined to be doing those things. So yeah, I applaud those mail carriers that are decreasing the likelihood of selling those things.
Awesome. Thank you so much. And I think, Catherine, did you provide any input on this? Oop. Is she there? There you are. We could see you. Yeah, it's on vaping. What do you think about the vaping crisis?
Can you hear me?
Yes.
Okay, perfect. So I would say that I guess accessibility, I think, of course, like education and communication is very important. But as well as like when you see the difference in the packaging for vaping products and like cigarettes, that there should be like a big warning label, I believe, on those vaping products as well, and which aren't there aren't really not the same as you would see, big print on cigarette packages. Um, and I think also there are a lot of like uh, types of like vape pens or little things that are like one-time use, and you can just like buy them. They're like $5 to $10, and they have a lot of stuff in it, so you can make it last depending on how much you smoke it for a couple days. But like that makes like it a lot more accessible, especially with the price being so low. For those, so I feel like those should be banned or at least regulated a lot more.
Awesome. Thank you so much. And I think we have one more question. Yay.
Yeah. So, how do we help our children, youth, and adults with ADHD? This we are going to talk about without Adderall. How we are going to manage them, because we see like around some 8.6% of the children, 8 to 15-year-olds, they have ADHD, and quite a lot of people they are misdiagnosed or they are using some others drug, some other people's prescription and taking Adderall. So in order to see like we have some steps from the mental health therapist itself, like to handle children this way to prevent the starting of Adderall. Once you start it becomes an addiction later. So how do we like deal with the children? The first and foremost is like we have to understand all of us have some issues, all of us have a little bit of attention deficit, all of us have a little bit of anxiety, little bit of depression. So only when it just goes a little bit more, like then we diagnose them with like a mental health illness or something. We have something called an acceptance commitment therapy in counseling. That's a recent grounds where they say like we are labeling people, like when we see like Winnie the Pooh, like like we had fun during childhood, like seeing Winnie the Pooh, like all those characters in that, Tiger and all those things. But now like when I become a mental health person, what will I do? I will start labeling them. Winnie the Pooh as obesity, like a hyperactive, or Tiger as a hyperactive, like Irie, whoever, like that character's depression, like do we need to do that to people? I mean, like we need to do that for the sake of diagnosis and treating them, so do we need to really label people? Even in among groups of friends, I have seen people saying, oh, that's a depressive character, like this is a maniac, like sort of all these labels we have to drop about people. They are people, they have a little bit of problem now, that's it. That's just a challenge which we can help, which we can like without labeling them, make them inclusive in all our activities and everything, like be with them, because the tomorrow, the next moment doesn't exempt me from any mental health disease, doesn't exempt me from any crisis. That's what we need to understand about people. We have to be like mindful of that. I may go into that state, so that's the kind of mind state like we should have with people. We have to be very, very supportive to them, so be inclusive to them. And first and foremost, when you see a child to be hyperactive, we have seen many spiritual people being hyperactive in their childhood. Like I don't know if you have heard about Swami Vivekananda, who had like a Chicago like federation of religions. He was presenting before everyone, and he's very famous. He came to Chicago like maybe 100 years before. So like he was such a hyperactive child, and like you should see the anecdotes from his mother, how hyperactive he was during his childhood. And if he has been prescribed with Adderall and he became like addicted to Adderall, we would have lost such a noble souls. We have so many people like that with us. Even I heard like like Edison had been hyperactive in his childhood. So like all this, let's be mindful of like dealing them with natural steps. How do we deal with that? Like you can train the teachers, you can train the caretakers, parents, and everyone in a school setting to just, like organize themselves. Like don't give bigger task. If you give bigger task to children, they are going to get tensed about that, and because they don't know to break it into smaller pieces. Like give them a smaller steps. Like once you realize a child is hyperactive and cannot focus, like giving them small activities actually makes them, like they will finish one thing, they will become very powerful in their subconscious, then they will go to the next. So let's be mindful of this. We have, like some tools with us with which we can deal with the ADHD children. So the next thing is like when we start some free services in our public schools, you know you can treat, maybe like, like we have around 3 public high schools in our locality. If we like have a workshop or something, like once in a fortnight or once in a month for the children, like tell them, like how to focus, how to organize yourself, and they are going to do the little task. You have to reward them because they don't know to do this. If you reward someone, that's going to reinforce that behavior. So they get to know in their mind, like rewarding and your appreciations is going to increase the dopamine in them. Like you don't need an external Adderall to do all these nonsense. So you can actually give that support to the children. So for the smaller task that you are breaking and giving them, if they are finishing it, give a reward to them. It's going to reinforce their positive behavior, and be with them, include them in everything, like then give them organizers and all that. So like, like it helps them to organize themselves. So what's, like some children like love to play outside, they don't want to be in classroom. It's okay, let them play. Like maybe we have a teacher assigned to those, like children who are outside. Like I know one of my friend's son who was like that. Like he was gifted, like with some teachers who actually traveled with him, who made him like realize, like, like he has to sit in a classroom at least a few minutes, then reward him at that time. That actually motivated him to be like, like more in the classroom. And like if at all the teachers were fed up with the child, they would have given him Adderall. And like maybe, I'm not saying Adderall is wrong, but it has the potential of addiction. So can we look at like, like managing people initially with all our love and care, and then look for drugs? Like maybe even if they are going to take their drugs, let's be with them, understand what they are undergoing, whether they are taking the drugs properly. Don't give it to them. Like when they are taking, somebody is monitoring, like whether they are taking properly or they are taking overdose or something. Like someone has to be there. So when adults, they are having an ADHD, like then we advise them to go to a mental health provider or therapist. And even in offices, we understand somebody is hyperactive, like then they are not focused, they are not doing their job. Let's be mindful of them, make them aware. Adults, like, like if you make them aware that, like the work environment, they are not doing their job, they are hyperactive, little bit, if you are able to like make them aware and give them, like a larger task into a smaller task, like just be supportive to them, like they are going to come back. So let's not put people initially to drugs for want of our own patience and support for people. So like, like let's grow in all this, be patient with our surroundings, and like give them all these things. And one of our Facebook friends, Brenton, was sharing that, like um he had like lot of like, like histories about people having both ADHD and autism. He said that's going to be a nightmare. Yeah, we accept that, Brendan. It's a lot. That's why we took this topic, and we think these kind of mental awareness topics, these kind of mental health discussions are very important for people to know, like these drugs are dangerous. They have to be taken by prescription from a mental health therapist. Yeah, let's be careful with all this.
Perfect. Thank you so much, Indu. Does anyone else have anything to add to this before we hop off here? It's been such an informative discussion. Wow.
I do have a comment that I would like to make.
Yeah.
So I completely agree with what Indu was saying. My brother, again, when he was younger, ever since he was from an elementary school until he started high school, every day the teachers would always call our mother saying he has a lot of disruptive behavior issues and that he can't sit down. Either he's sleeping or he's moving around or he just won't pay attention. Rather than quickly assuming that my brother might have ADHD, my mom, what she would do is that she would take him to a psychologist to see if he does have it or not. But one thing that I really admire that she did is that she would really spend every night with him while he would do his homework, and she would modify how he would do his homework. So typically, like I guess like parents would assume that you just have to sit down at the table and read and just do everything in one setting, or at least like in 30 minutes, then take a break. But my brother, what he would do is that he would pay attention more when he was walking around. So my mother adhered to his way of learning, and that it's how he learned how to behave, not necessarily behave, but do better in school. And as well, my mother, she abhors medication of all sorts. And she's also very naturalistic in the sense that she would rather take, I guess like different types of herbs or types of oils. Well, not just those, but those general things. Instead of like straight going into medications, which of course could lead to addiction. And that's what she really feared from my brother. So she would try different ways to help calm him down. She's a very big fan of using essential oils, and like she always used like lavender for air diffusers, and that helped him focus a lot more. Mind you, this might not work for a lot of people, and it is up to the person who believes in these natural remedies. But sometimes they do have an effect, whether they're placebo effects or not. If the person is exhibiting positive outcomes, I don't see why that would be a bad thing to adhere to. So yeah, so I really personally relate a lot to this topic as well. And medication doesn't always have to be given to the youth. If there is a way to I guess go towards it in a different way, or at least try, see how your child reacts to it, and if it simply doesn't work, of course, go to a psychologist and to a doctor and see what they can do, because help is always needed, and everyone deserves to get help as well.
Awesome. Thank you so much, Nicole. Luna, do you have anything to add?
I also just wanted to add on to what Nico was saying. Like, there's a ton of different ways to come at like ADHD and all of that. And like my brothers both like have a little bit of ADHD, but like my parents never really wanted to like do a lot of medication if they didn't have to. And so like one of my brothers did something for a few years where he would go to like the psychiatrist, and they did some sort of like mental training like with their brain. And so it was like a different approach, which was really cool. And also just one thing to add, like I feel like a lot of people that do have like ADHD and those kind of disorders, they are generally pretty gifted, and like so you really just have to focus on, you know, what interests them and that kind of stuff, rather than just focusing on making them, you know, do everything the traditional way, because that can just be really tough on them.
Mm. Thank you so much. That's so informative. Catherine, did you want to add to that? Oh, you're on mute.
People have it. Oh, I'm on mute.
No, you're off now.
Okay. It seems like everyone seemed to cover it. I mean, my brother also, he's been prescribed Adderall, but we kind of took it from on holidays or weekends or things like that. Don't take it if you don't like, there's nothing you need to do and use it for. Because like, yeah, we didn't want him to just use it all the time. So it was pretty much, he would only feel like he needed to use it when it came to like, if he had to write an in-class essay or things like that, where he would have had to like just sit down and focus on that one thing for so long. So I know Adderall really helped him, but it was, just making sure that it was taken when he felt was absolutely necessary, instead of just like, every time he went to school or things like that. Because during those times, like, yeah, when he went to school, he might have some issue concentrating, but he'd find ways to like, other ways to help him like focus and do the work that he needs to get done. But when it was like, something that he knew would be like an issue for him to just sit there and concentrate that whole time, like standardized testing or something, then he would take the Adderall. So, yeah, it's just really finding what works for you if you do have ADHD, and again, talking with your psychiatrist and your doctor. But then yeah, when it comes to Adderall misuse, just don't do it. Like, you know, find better time organization habits and study habits that will make it so that you don't feel like you have to, take these focusing agents and like cram everything into this one time. Really focus on, learning those skills of time management and organization so you don't feel like you have to do this to get like take Adderall or anything like that to get those things done. But yeah.
Awesome. Thank you so much, Catherine. And Janan, I'd like to hear from you, and then Kendrick. Oh, you're on mute. I got you. Ooh. Oh, you muted yourself. There you are.
Sorry. Okay. This was kind of already covered, but kind of just, I think one of the best ways we can support people with ADHD is trying to just see what natural remedies there are. And of course, this was already mentioned a million times already, but I think people are always very quick to resort to medication, and there's nothing wrong with medication, but I think a lot of times there are natural interventions that can be instated beforehand to try to fix the situation and make it manageable. And if it absolutely is not, then of course, seeing a doctor is probably the best option. But just, I guess, seeing what natural interventions there are before stepping it up a level.
Amazing insights. Thank you so much, Janan. And last but not least, we have Kendrick.
Just mostly everything I was thinking was mentioned, but just to piggyback off everyone. There's, I think a big thing is just managing. Like for example, let's say we have a big project consisting of like 5 parts. Splitting that up throughout a long period of time, piece by piece, is going to be a lot more helpful than cramming it that last weekend. So I think time management is a big one. Another, as people were saying, is not, medication is, helpful for a lot, but it's kind of a slippery slope. People will sometimes misuse them, as stated before and throughout the whole presentation. But yeah, look for natural remedies, whether that be, going on a walk to de-stress, just doing something that, calms you down, in general. Just to like I said, to piggyback off everyone, that's about what I have to say.
Amazing. Thank you guys so much for this insightful conversation and the discussion around, ADHD and the prescription drug Adderall. So we are going to go ahead and log off now, but we would love if you could join us on Friday at the same time on the same platforms. We will be interviewing our celebrity, Ken Seeley, from the Intervention television show. So that will be really exciting. And with him, we will be discussing prescription drug abuse, and also hearing the new developments with the show itself. Right now, they are filming a series in Las Vegas. The new series is up, I believe, on Hulu and I believe Lifetime. So check that out if you can. And we look forward to seeing you then. Thanks for joining our amazing Assuaged team. Let's wave bye.